Good afternoon, and welcome to the Wellesley Centers for Women's first of two social change dialogues for the fall. I'm Layli Maparyan, Executive Director of WCW. Today's very timely program is COVID-19 and gender equality. COVID has certainly been a defining aspect of 2020, and today we convene three of WCW's experts for a conversation. Our program will begin with a moderated discussion panel followed by a Q&A session where we will take questions from you, the audience. A few housekeeping matters related to this Zoom webinar format that everyone should be aware of. First, to keep things running smoothly, we will disable the chat, and we ask that you send all of your questions using the Q&A feature that you should see at the bottom of your screen. We will be monitoring the Q&A throughout the program, and that is where you can enter any questions that you have for our panelists. We will get to as many as we can during the Q&A portion. Second, we are recording this program, and the video will be posted on our website for folks who are not able to join us this afternoon. For those of you who may be joining us for the first time, the Wellesley Centers for Women is a research and action institute at Wellesley College. WCW's mission is to advance gender equality, social justice, and human well-being through high-quality research, theory, and action programs. For 45 years, we've been focused on shaping a better world for women and girls, families and communities in all their diversity here and around the world. Let me now introduce you to the three wonderful women who will be sharing their research, action, and expansive scholarly expertise with us today. First, Craddock Ph.D. is an applied psychologist and visiting scholar at the Wellesley Centers for Women. Her research interests include socio-cultural contexts and relational frameworks that center on issues of equity and wellness, leadership and partnership, and capacity building across sectors. Her practice is grounded in psycho-emotional functioning, relational cultural theory, and multidiscipline connection, including explorations of race, gender, resilience, creative expression, and the neuroscience of inclusion. She's the editor of the 2015 book, Black Motherhoods, Contours, Contexts, and Considerations. And her written and editorial works have also covered a range of topics, including the pain of racialized exclusion and the importance of viewing COVID-19 through an equity lens. Karen is the co-founder of the Wellness Collaborative Incorporated, an interdisciplinary collective working towards improved health and wellness, especially for those experiencing the most disparities. She is also a tribal member and committee chair of the Safe Harbor for the People of the First Light, Wampanoag. Second, Sari Kerr, Ph.D., is a senior research scientist and program director at the Wellesley Centers for Women and a research economist with the National Bureau of Economic Research. Her studies on the gender wage gap, the mommy track, family leave policy, and immigrant entrepreneurship have brought much needed nuance to our knowledge about women in the workplace. Sari is primarily interested in how labor markets, along with policy and industrial conditions, shape the behavior of firms and the career trajectories of their employees. In 2019, she testified in the United States Congress on the impact of immigrant entrepreneurs in the US economy. Her work is frequently covered in popular media outlets such as the New York Times, the Wall Street Journal, Bloomberg, the Washington Post, and Harvard Business Review. And third, Wendy Wagner Robeson, Ed.D., is a senior research scientist with the Work, Families, and Children Research Group at WCW and lecturer in Wellesley College's Department of Women's and Gender Studies. Wendy has an extensive research background in child development, early child care and education, child care policy, school readiness, literacy, and language. She has served as principal investigator or project director on numerous studies. Throughout this year, Wendy has consulted with two large school districts regarding the quality of early care and education programs in their schools and cities, and worked with the Federal Reserve Bank of Boston on mothers' perceptions and trade-offs in their work and childcare. Since the beginning of the pandemic, she has worked with early childhood education advocates from across the state to assess the impact of COVID-19 on the childcare and education industry. Presently, she is working with the City of Boston Mayor's Office of Women's Advancement on projects involving families living through COVID, as well as working with the city's family child care providers. Now, to kick off our event, we would like everyone in the audience to answer a quick poll to let us know how you have been impacted by the pandemic? Please take a moment to answer the poll on your screen. As we know, and have probably all experienced, pandemics tend to have an outsized impact on women and families beyond the immediate health risks. COVID-19 is no exception. During this program, our panelists will discuss the unique ways that COVID-19 is impacting women's work-life balance, economic opportunity, and mental well-being. This poll will help us get in touch with how we as an audience have been impacted by the topics that we'll be discussing today. Now, I see that people are still logging in their answers, so I'll give it another few seconds and then we'll take a look at the results of the poll together. But already I can see a few trends. For example, it's clear that many people are experiencing more stress than usual. It's also clear that more people are working from home. It seems like some people are also dealing with helping kids with remote learning and having hours cut at work, but fewer people are reporting that they're cutting back hours to care for kids, and few people are reporting that they're an essential worker. So this gives you a sense of who we have in the audience today and what kinds of issues that we're all dealing with. I hope that you find in today's conversations things that help you think in new and interesting ways about what we're all experiencing and help us think about ways to actually continue to work towards gender equality despite the challenges of this time. So let's get started. I'm going to begin with a question that's directed to all of the panelists. The gender effects of the COVID-19 pandemic highlight the uneven progress toward gender equality. From your area of expertise, what is one of the biggest obstacles to gender equality that's been exacerbated by the COVID-19 pandemic? And Wendy, I'll start off with you.
Thank you. So working mothers are feeling overwhelmed by COVID-19 due to problems surrounding childcare and school responsibilities, or what has been known as a crisis of care. Many mothers are cutting back their hours and many others are leaving the workforce. This is because mothers still take on more of the household, childcare, and school responsibilities compared to fathers in heterosexual couples. The pandemic has magnified the gender inequality at home and at work. Many mothers are exhausted by what was thought at first to be a few weeks, then a few months, and is now a way of life for the near future. The Center for American Progress recently found that millennial moms are almost 3 times more likely than millennial dads to report they are unable to work due to childcare and school closures. The U.S. Census from August found that between April and July, more than 1/3 of working millennial mothers said they were not working due to caring for children or for children not in school or childcare. Lack of childcare is greater for women of color, those without college degrees, or from lower income households. A recent study by the Board List found that twice as many women as men believe that working from home could have a somewhat or extremely negative impact on their careers. They also learned that work from home dads were 3 times more likely than moms to receive a promotion while working from home. The Mass Commission on the Status of Women did a survey back in April of 3,000 residents, and they found that 11% of all respondents had lost their jobs, and that women reported that they had increased responsibilities in the home, including homeschooling. The Lean In organization recently reported that 1 in 3 mothers may be forced by the pandemic to scale back their hours or leave the workforce entirely. Thanks.
That's a lot. Thank you for that information, Wendy. Sari, what would you say?
I agree with everything that Wendy was saying, and I would note that in 2 working parent families and 2 career families in particular, the even well before the pandemic, the childcare and household responsibilities were never split 50-50. They've always sort of followed a pattern where women have done more, and certainly as schools and daycares closed, and I would note again, this happened way more in the United States than it happened in many other countries. Many other countries keeping schools and daycares open was a big priority more so than in here. It meant that children were at home, children were doing remote learning, and mothers took a much larger share of that additional responsibility and all the additional cooking and grocery running and all that. It was additional responsibility was not 50-50 either. So I feel like we lost a lot of ground there as this division of labor is now more uneven than it was in the beginning of last spring. More on the positive note, perhaps, it is still true that modern dads do more with kids than their fathers did. So we have moved towards more equality if we compare to the previous generation. And I'm sure all parents right now would agree that they've never done more with their kids than they do now. That this is kind of extreme parenting that most of us never felt like we signed up for when we had children.
Mm-hmm.
So this could, in the long run, lead to a social norm change where we now notice that dads can do more. Even if the share is more unequal, the amount that both mom and dads do has definitely gone up.
Mm-hmm. Well, thank you. Karen, what do you think from your area of work? You're on mute.
Immediately comes to mind when I'm thinking about the overarching issue of COVID-19 and its impact and the implications for gender equality. I guess I'm thinking more along the lines of what does this mean in terms of where we are located, our social location, and our psycho-emotional kind of well-being. And we know that in moments of crisis, we tend to move towards places of the comfort or the known spaces and places. And I think this is true for us personally, as well as societally. So we'll often take refuge in what is familiar. And I think even when that may manifest in thoughts or feelings or actions that may even be known to be divisive or fragmented, they tend to be the places that we'll go to when in the moment of crisis. So regarding, I think, gender equality efforts, unfortunately, and I think this is well known certainly in feminist circles and those that have researched and looked into what the implications are for gender equality in general. I think there's this persistent omission of the interwoven nature of race and gender when it comes to gender equality. So I think in this particular moment, those issues are surfacing maybe even a little more. I think it's something that we're going to have to pay close attention to. We can kind of get set back or lose sight of the intersectional nature of the lived realities of what it means around race, ethnicity, and gender, and those issues of division and inequality. So.
Thank you. I like how you've all highlighted different aspects of the crisis, but they're all very interrelated in many key ways. I'm sure we'll have a chance to break out some of these themes. In fact, this question is going to be directed at you, Sari. Past recessions have often affected men's employment more severely than women's employment. How has the economic downturn caused by COVID-19 compared to past recessions in terms of employment?
So for the past few recessions in particular, we've heard them called man sessions, mostly because the sectors of the economy that have been most heavily hit have been those where more men than women are working. Whereas this COVID-related downturn is definitely different. And this is one where women are going to be well overrepresented in the sectors that are the heaviest hit, especially if we think about what happened in the spring with the service sector where establishments were closed, especially personal services, food services, accommodation, tourism, travel, catering, all kinds of establishments were closed where well over 50% of the workforce is women, versus for the male heavy sectors like manufacturing, transportation, and construction. While those sectors were hit also, the effect was more short-lived and it wasn't as large. We still see, even if establishments are now operating again, that the customers aren't fully back, and the long-run effects of the recession will be long-lasting for women. Many firms exited permanently. They may have gone bankrupt. And even in the establishments that survived, we've had a lot of women experiencing long-term unemployment. And what happens with the long-term unemployment is that lost work experience can never be recouped again. And economists think that work experience carries significant economic returns in terms of future promotion possibilities, wage increases, and so forth. That is permanently lost for this generation of women who had suffered through the COVID crisis.
Yeah, it's really an important time to be studying, sort of setting up studies now so that we'll be able to understand some of these impacts over the long term. Wendy, what do you think about that?
Well, piggybacking what Sari said, we know from past research that when women leave the workforce, they have trouble re-entering the longer they stay out. And before the pandemic, women passed men on the US payrolls in terms of a number, except for the areas of farms and self-employment. And that number went back to 1980 levels this spring. This new reality could have a lasting effect on gender equality in the workplace for years. 4 times, that's 4 times more women than men dropped out of the workforce in September alone, according to the US Bureau of Labor Statistics. And women's jobs and careers are lost due to the uneven sharing and unending pressures of childcare of young children and the schooling of school-age children at home. When there are 2 incomes in a family, the higher income parent is the one who works, as it makes more sense for the one with the higher income to go back to work, and in heterosexual couples, that is often the man. Furthermore, many women who lost their jobs were in industries, as Sari said, with industries where more women are present, such as hospitality, food services, as well as high-risk industries such as healthcare. Women of color have been the hardest hit. Latina unemployment rose in September alone from 10.5 to 11%. And Black women's unemployment rose in September to 11.1%. The pandemic will reduce women's lifetime earnings potential if they leave the workforce entirely. With respect to employers, I found that work from home mothers are reporting that employers have been more flexible. However, the workload has not decreased, and the only real flexibility is when the work is done. So many mothers are getting up early or staying late after the children have been put to bed to complete their work for fear that others will think they're not pulling their weight or will criticize their work ethic.
Mm-hmm. I mean, based on what the two of you have said, it really sounds like we're in the midst of a tidal wave of change, and that it's hard to see it because it's going on right around us. But 10 years from now, we're going to be able to look back and see a real tidal wave of change. And, it's going to be interesting to see how that plays out as far as gender equality markers, at that point in time. And I'm also wondering, you mentioned about it's often the women who drop out because the men are the greater wage earners, but I know that we've also had increases in the recent past of women who are the primary earners for the family and also married and also have kids. So I'm curious, about what their lives are like as a unique segment as well. Wendy, I want to get a little bit more into the early care and education domain. The closures of schools and child care centers, along with the move to remote or hybrid learning, has had a tremendous impact on child care needs. How has this impacted working parents and particularly working mothers? How has the effect been different for essential workers such as doctors and nurses, teachers, food service and grocery workers, or fulfillment and delivery employees versus office workers and others who are able to work from home? I know you've mentioned it briefly, but maybe you could elaborate.
Thank you. So many child care programs across the country shut down in March. And returning to operating a child care program has been very hard due to the loss of tuition money, increased costs related to PPE, and new health guidelines. Programs were at a very thin margin to begin with, and when this loss happened, it caused many to have a really hard time to get back on their feet. Child Care Aware estimates that 30 to 50% of providers will permanently close. They're just not coming back. And this will make it harder for parents to find child care that they will need once they decide to return to their office parks or their office buildings or not work from home any longer. In Massachusetts, the Department of Early Care and Education implemented emergency care for essential workers through centers and family child care homes. This was care that did not cost families anything, but they had to enroll their children. Not all families did this or took advantage of this free care, and it ended when child care programs reopened at the end of June. Even with reopened child care, not all parents are sending their children back to any kind of care. They're keeping them home. Some parents are working from home, are keeping their children home to continued worries about COVID-19, or they're keeping their children home and having relatives, if they do have relatives, to take care for their children. The use of remote and hybrid learning for school-age children has added a new challenge faced by working parents. And has been noted, working mothers are exhausted by the never-ending work and childcare demands, especially with the hybrid schedule. What do I do with my child if I have to be at work? My child has nowhere to go but home. What am I supposed to do? And there are programs that are allowing children to come. After-school programs are going full-time, full day, but there's added cost to that. In addition, mothers who are in the childcare industry are finding it difficult to work if they have school-age children for the same reason. They can't leave, they need to return to work, but they can't leave their children home alone. Although a recent study found that up to 30% of families said they will leave their children home alone because they have no other option. This is leading to an even bigger crisis in finding qualified staff for both early childcare programs and out-of-school programs. Programs said that they have classrooms with children ready to start, but they can't because they don't have enough teachers to fill those roles. And there's hardly a program in Massachusetts that does not have a director spending her time as a teacher rather than as a director in a classroom that was not staffed. In addition, the number of family child care providers and programs in Massachusetts and throughout the country is shrinking drastically. And many providers have decided not to continue their business due to the pandemic. They just have closed their doors. So it's a problem.
It's a lot. It sounds like another sea change happening. And, you know, Wendy, I want to ask you a follow-up question based on some of the things that you said. You've worked in this sector a long time, and you probably have developed a sense of what the trends are and what the likely transformation of the industry is likely to be like because of this situation, or maybe even thinking about if you were designing it, how would you design it? I mean, given what we're looking at, please speak to that.
Well, it's for me, it's not just going back to the normal. It's going to be a new normal, or build back better is one of the phrases that people are saying. Build back better. And what I think needs to happen is that there needs to be a vast wave of money coming into the childcare infrastructure in order to build up our programs, to get programs back on their feet. We did have programs that did go for CARES money, but not enough there wasn't enough money to go around for everybody. It only took care of a little bit of the problem. We need a huge change. Just as we support public schools in this country with our tax dollars, we need to support childcare, because we've learned that childcare has to recover if we want our economy to recover. There's you cannot separate the two. Right. We cannot have families work if they cannot have childcare for their children.
Right. So it really sounds like you're talking about elevating it as a policy priority and thinking about how we fund it, particularly at the national level, but also at the state level. Right. And I'm curious your thoughts about the discovery, for better or worse, that remote learning is seemingly a new emergent thing that's not going to really go away. So even if things change, how does remote learning potentially figure into the early care and child educational landscape?
Well, they've tried doing remote learning for pre-K and kindergarten. And, if you have, or young children, they can maybe even sit still while you read a story for 5 minutes or something while you're with them and they have that warm emotional bond with you. Now you're having a story read to them in a screen. The teacher's trying to read them a story. No child is going to sit by themselves for more than 5 minutes. It just doesn't work. And we found that over and over again. It's cannot be done easily.
I've heard very similar stories, but I've also heard some very fascinating stories from some people I know with young children about how these very young kids are digital natives who know how to manage this machinery from a very young age, and are sometimes even telling their parents how to do things, you know? So it's going to be an interesting generation to watch.
Yes.
All right, well, now I have another question, and this is for everybody. What do you see as some of the potential long-term economic implications of the COVID-19 pandemic as it relates to gender equality, both positive and negative? And Sari, I'll let you kick that one off.
Yeah. So going a little bit back to what Wendy was saying earlier regarding the two working parent families, where oftentimes there's a primary career and a secondary career, I think that there's going to be a very long-term impact in this within household whose career matters, because it might have been a very rational decision at the time of the pandemic was to let one parent drop down in hours, or maybe even quit the secondary career and focus all efforts so that the primary career could be maintained. So at least there's some income in the family. That sort of within household dynamic will take a long time to recuperate. Part of it is related to the fact that many of the jobs have disappeared, and women-owned businesses have suffered greatly, and women-owned businesses particularly provide jobs for other women. So when we start the recovery effort in earnest, then it'll take a very long time for us to see the service sector, small businesses coming back, the retail sector, all those women-owned businesses that will eventually be able to provide the jobs. In some industries, the analysts believe that they may never fully come back. So if you think about the travel industry and things like conference travel, that pretty much evaporated, and analysts are evaluating, looking at it and saying it probably will never come back to the pre-pandemic levels, or it'll take at least 10 years or more to do so. So these sort of negative effects seem to me very tangible. There could be positive effects too, but they're more a little bit out there. If we think about, for example, the previous question to Wendy regarding childcare centers and other places where we have a lot of essential work being done and essential workers, I think our appreciation of essential work and essential workers did increase. It's very clear for all of us what they do. Sometimes it may have been a little bit invisible for us, but now teaching happens in our homes, and many of these essential workers are being valued highly for being in the front lines. I have some hope that this might manifest in better pay and better appreciation also in the future, but that remains to be seen. And another sort of going back to what Wendy was talking about, topic on the firms, what the employers are requiring. Many firms are saying that they notice now that remote work can work. Teleworking is not just a fringe thing, it actually could work. And once kids actually go back to schools, firms are willing to let more people telework. Large firms are thinking that this could even be a cost saving in terms of office space needs, and workers could certainly benefit if they don't have to commute every day. So this could lead to a bit of a culture shift in terms of what firms can do in terms of flexible work arrangements that women can take advantage of. And since employers also, they literally got a direct view into our living rooms through all this teleworking. They know now what the work-family struggle is, what are we dealing with in our homes. Hopefully that'll allow them to think about this good worker, what is a good worker, what is a dedicated worker norm a little bit more, and lead to a long-term culture shift in there too.
Mm-hmm. Yeah, I like what you said about essential workers, because one interesting outcome of this pandemic is that we now have a new terminology. We weren't calling a lot of these workers essential workers before. I mean, maybe we were for doctors and nurses, but certainly not for grocery, store workers and logistics people and, package deliverers. So we've got a new term, and that term almost has social justice implications of its own. And I'm wondering how those are going to play out over time. That's another thing for us to watch, to see if that does actually shift the way those workers are viewed and treated, as you mentioned, with regard to both income and benefits. I also was curiously listening about, the way that remote working is going to become more normal. And I'm wondering, and this has been a question in my mind for a while, is how is this going to change the real estate landscape? Because if so many people are working at home, people are not going to have giant office buildings and pay those bills. There's going to be empty real estate or something's going to happen. So I think that one's one to watch as well. Wendy, I know you had a few points you wanted to make in response to this question.
I'm more negative than positive about this, because I think it's going to affect equality for years in the workplace. I think there's going to be fewer women that are full-time and fewer women at all in the workplace. And I think it's just going to be a brand new reality, and it's going to have a long-term effect on gender equality of all that we worked for years in the workplace. I think we're going to have to work our way back up. I really do.
Wow, that's a strong statement. Karen, what do you think?
Sure. This is long-term for sure. And there are certainly going to be long-standing negative implications. And again, using this lens of looking at these intersectional spaces, I think when we think about the long-term future impact, I think we have to consider, whenever we're thinking about the future impact, we have to kind of make sure that we're taking account of the historical backdrop. All of the core of all equity work is making sure that we're being mindful to the context that we're in. So the social historical context of race gender biases when it comes to just workforce in general and gender equality is going to be critical. And I guess I'm thinking most significantly, we've been mentioning here about essential workers and those at the front lines. Wendy's already mentioned that the disproportionate rate of women of color in these particular roles. I think, we look across African American, we've got Native Indigenous women, Latinx women at the front lines in these nursing assistants, childcare workers, cashiers in these spaces. There certainly is this huge implications. They might be essential for this moment, but we also know that the front lines of also contracting the virus itself, and then all the subsequent effects of what that means in terms of their family. So I think we have to look at this multi-generationally. What does this mean for households and communities for those that are at the front lines? With regards to, I think, women across sectors, we know that women of color probably are highly represented in the nonprofit sector. A recent study that just reported the bulk of the work that's carried out across the nonprofit sector are women of color, yet there's this disconnect with senior executive leadership in the nonprofit sector. It has the least amount of women of color. So at a moment where we're leaning heavily probably on this sector for services and resources and work of all kinds, again, this has this undue impact on women of color, and I think this will in fact have long-lasting effects. If there is a positive, I think, to this in terms of the long-term effect, I'm thinking about this heightened awareness. We are in this moment of this dual pandemic, if you will, right? So the COVID virus and the issues of racial and social injustice coming to bear. It certainly has put the face of health disparities on the front line globally with this attention and this accentuated moment. I think there's an undeniable shift in accountability that systems are needing to pay attention to, and that we're having kind of the world is watching. And I think Wendy's termed this build back better. I think folks are saying, this is not about returning to any normal. Normal for many has been a chronic state of being marginalized and with all types of psychic and emotional and physical violence. So how do we take this moment to look at what's happening and build back better? And we may, again, just have more of this global lens and a collective effort to turn the tide. So that might be at least a positive bent now in terms of heightened awareness and accountability.
Yeah, that's a lot. And I think you've definitely anticipated my next question about the outsized impact of COVID-19 on people of color and all the ways to look at that intersectionality, intersectionally. And I'm wondering if there are additional comments that you'd like to make about how we should be thinking about that and how we should be using this moment as a transformational moment to advance equality that does take the intersections of race and gender and class and all those other things, culture, into account. What are your thoughts on that?
Sure. So I think, we can just look at the data. It speaks for itself. The ratio of cases, hospitalizations, and deaths is highest amongst African Americans, Native and Indigenous populations. So I think looking at those two subset populations, which for me in my own research and the work that I'm doing and particularly aware of and working with, that I think of, so there's the UN Women's Report that has looked at what's the COVID impact on women broadly. What are some of the broader issues, both directly in terms of the impact of the virus itself, and then what are some of those indirect impacts or implications? So in looking at the two communities, two areas that come to mind, particularly when we're thinking about Native Indigenous women in particular. The first, I think, is this longstanding issue of violence against women, domestic violence, this prevailing and this persistent disproportionate numbers of Native women who've been affected by violence. And this is both intimate partner violence as well as just kind of unknown predators. And some of this has implications in terms of regional location, access to, veritable and positive ending social justice or governance in terms of actually convicting those that have been violators of women, Native Indigenous women. Breakdowns, I think, just in terms of reporting the data itself. I know that our colleagues in Seattle in particular have looked at specifically the disproportionate ways in which even request for resources or even documenting Native Indigenous women in terms of the numbers with this COVID issues and its impact, particularly on violence against them, has not even been captured. So there's that level of erasure, which is the other piece, lack of access to quality services, resources, and erasure. Black women in particular, the issues of unpaid work. And I think that this is something that is important to make note of across income and education levels. So Wendy has spoken about this, Sari as well, with regards to women at the front lines who are in these lower economic standing jobs, if you will. But I think the issues since, both the school closures with COVID, women working from home, you have women of color across economic sectors, right? And across these standings are having to take on multiple roles and oftentimes with unpaid work. Even in these settings where they're being looked to answer or to speak to on behalf of women of color. Very specifically, I've talked to Black women and colleagues who are researchers, practitioners, corporate executives, that while they have to continue to carry out their work, they're also being looked to speak to what has the impact been on, or how are you addressing these issues? So oftentimes this is work that's happening in the volunteer space that is unpaid, and again, it has another undue strain. And the latter part of that, I think, has to do with women's health in general for Black women, specifically as it's connected to Black maternal health and wellness. We know well-documented health disparities among Black women in the US, and this includes both quality of care, being dismissed or turned away when they've gone for care, being denied pain medication, and that's a whole other separate sector. But we also know that there's 3 times the rate of white women when it comes to maternal mortality. So these exacerbating issues within COVID has been pointed out in a number of different ways. And I think there's a couple in particular when it comes to Black women and health and how they intersect. Just with the onset of telehealth, there's one. We know that that's an area that's being used more readily now, but it does have some implications when it comes to being able to determine pre-existing conditions or maybe preterm implications for women that are pregnant. You can't always discern as well in the telehealth platform, so that's one. And we know that Black women in particular have implications for higher rates of early term miscarriage. So the second is being, this is the limited support during labor. We know that just with COVID, there's very limited folks that can be even allowed in the room, right? So we're even thinking about support systems, the use of doulas or midwives. That's been another kind of documented. You don't have that access to the same types of supports during pregnancy and labor. And then there's the limited support systems and issues of isolation and economic pressures post-delivery. And I am thinking again about some of what Wendy is just mentioning here about the issues of childcare. So, in those early stages of coming home postpartum, the supports are high, and then being able to return to work. And if in fact you have, again, the strain on the workforce and limited supports at home, again, the intersections of what this means for Black women's health and Black maternal health in particular really are exacerbated in this COVID moment.
Yeah, that's a really long list of factors. I was fascinated by something you said a few moments ago that almost made me think you were saying that for women of color and Indigenous women that sometimes it's like activism is a job. It's an extra bit of unpaid labor. I mean, you didn't use the word activism, but we know that in the recent climate of racial justice demonstrations and renewed emphasis on anti-racism in the wider society, that participation in those movements can be time consuming. That it also uses emotional, physical labor. So, I mean, I heard that in your comments as well.
Absolutely. Activism and advocacy, it's the inextricable and unstated but ongoing work that is required of women of color.
Yeah. So I know you've been very involved with the Safe Harbor for the People of the First Light. Do you want to say anything about what that organization has been doing in response to any of this?
Sure, and I will say that, so this grew out of, the Aquinnah Wampanoag tribe and the Wampanoag Nation broadly, just beginning with the task force as we were beginning to explore and understand what the needs are, and certainly of the women here in the Northeast Woodland Nations, not just the Wampanoag, but other tribes in the New England tribal nations, understanding what are the needs specifically in terms of health and wellness, and also understanding what are the rates, again, reported and unreported on issues of violence. So it started as a task force. We gathered some data. Again, this is where data is so critically important. Why I had mentioned oftentimes Native and Indigenous groups and communities are coupled together with others in the other category, unnamed. And so even the data is off in terms of really measuring and understanding what the impact is. So with the work of the Wampanoag Women's Center now, the Safe Harbor for People of the First Light, beginning with the task force to collect the data. And this is both quantified data in terms of survey, but anecdotal data and qualitative data in terms of focus groups and storytelling and coming together with our community. I mean, from that, we got funding through the VAWA grant, the Violence Against Women Act grants to support both services, direct support services, education, and awareness building within our community, our tribal community. We were able to get domestic violence advocates trained. We also partnered with the Southwest Law and Policy Center to do specific training for forensic level of domestic violence, sexual assault supports with the Safe Star system, so that we're building capacity within our tribal nation for understanding and supporting the needs, particularly of Native and Indigenous women, but anyone in our tribal community and the surrounding area. And we know that as these things are inextricable and co-aligned with social, emotional health and well-being, the work has grown more broadly, and that is also now addressing the health of the entire tribal community. And obviously in partnership and coalition with other nations across the New England and Southwest regions and across all of the United States, so that we're building stronger coalitions of support.
Yeah, I appreciate that. I think you're really shining the light on some activity that a lot of people may be less familiar with. That's also a great segue to our next question, which has to do with the fact that given the disproportionate impact of COVID-19 on gender equality that we've discussed, what are the mental health implications for women? I know, Karen, you work in that arena. I know, Wendy, you've touched on it. So Karen, what do you want to say about mental health in this situation? Obviously, stress was the biggest response, everybody in the audience.
That's where I wanted to begin, right? So everyone, even just here listening in, we know that, there's an accentuated and undue amount of stress that is on us. And we know then that the stress physiology and the way that it works in terms of our psychological and emotional health and well-being are co-aligned. So for me, I do believe that we're dealing with the direct impact of COVID itself, certainly the mental and emotional strain about just coping with it. Do you have enough PPE? Do we have the adequate amount of training and make sure that our environments are safe, both at home or at work or when we're traveling? Are we being, this in terms of care, right? So the care work that's involved, caring for elders and for young people, that's all a part of our day-to-day thinking, not only for ourselves, but for our families. And the issues of social isolation. So, and a lot of the thinking that I've done and the work that I'm doing, particularly with the Wellness Collaborative, we're thinking about how do we reframe language and build community in the midst of this disconnected moment. And so the term really pushing back against social distancing and really thinking about physical distancing as a very specific way of thinking about how we must stay connected. Social isolation, I think, rises to the top. I think we're feeling a lot of stress, particularly because we feel so incredibly disconnected. So even as we're practicing safely to stay 6 feet apart and be physically distant, what are some innovative and creative ways that we continue to stay socially connected? And here I will say, certainly we're making the use of technology and Zoom, which is great. but it isn't lost on me, even as we're talking about remote learning, that there is a digital divide, at play, and that we can't make assumptions that every single household has the means and the equipment to stay connected in this way. And then it has, it's pushing us to really think about other ways that we can support our mental and emotional health that may not involve necessarily technology, and how might we do that safely. But it certainly is top of mind, and I think, again, not making assumptions that every household is the same.
Yeah, those are some really good points. Wendy, what do you think about this question of mental health?
Well, from the talks and the focus groups I've done with parents, almost every parent revealed that they from the beginning, they isolated themselves. They were in their own little bubbles. They tried to protect themselves because of the fear of the virus and of the unknown and what was going to happen. Many parents and many families are waiting for a vaccine to be developed, but at the same time, they fear that there'll be a surge in cases as winter comes. Fall's already here, and they're really afraid that they're going to be forced back inside, back into those bubbles. Parents fear for the socialization and well-being of their children's mental health and social emotional well-being because they're not around other children and they're not around their friends at school or childcare. We had moms tell us that one parent, they're speaking of their toddlers who tell strangers to stay away from them when they're outside. They say, stay back, stay back. These are toddlers who are telling others to stay away when they're outside. Children are watching more videos and have had much more screen times than their parents would ever have allowed 6 months ago. One parent told us they fear their child has missed a year of his life. This is for a 4-year-old, and worried about the long-term effects of his social emotional development and his increased anxiety. This parent said their son spends too much time looking at screens and their own working prevents them from tending to his needs. The parent said his son misses his friends and asks too many questions about death and dying, has trouble sleeping, and is plagued by monsters. The parent found that the child's mental health did improve when he was back in care for 5 weeks and was able to be with friends. Another dad told us that his 2 children, ages 2 and 4, would scream for their mother whenever she would try to teach by Zoom or when she was on the phone. And another mother said that her kindergarten-age daughter stopped talking and communicating whenever she had to do school over Zoom. And then with respect to parents, the crisis is having a negative effect on parents' mental health as well, as many are so exhausted and so burnt out from trying to do parenting and working at the same time. Single parents fear getting sick with no one to care for their children. Essential workers and others are forced back into their work sites due to economic reasons. Also fear getting themselves or other family members sick, and many have lacked or do lack the PPE at their work sites at the beginning or even now. They do not have the equipment they need. Mothers have told us that one mom who was an essential worker, she had to send her 2 children away to stay in Maryland because she had to learn how to cope with this whole crisis herself and she needed to have her children stay with relatives while she did this. A mom from a dual income family said that it was hard when both she and her husband are so stressed and she doesn't feel as engaged in work as she was before. Another essential worker mom said that in addition to her long hours, the constant cleaning at home resulted in her having to be prescribed anxiety medication. A single mother is stressed and she doesn't sleep, and she says she has no real support. She worries that her foster children will be taken away from her if she gets sick, and they're right at the pre-adoption stage. And she does not know what she's going to do. And she says, what will she do if it goes on week after week? And she's stressed out both mentally and physically. Another mom said that her life goals are gone, and she feels that everything she has been working for has been uprooted, and that she's just trying to get through 1 month at a time. And she said that she feels that she's still in the shake and bake and hasn't been dumped out yet. She has no idea what she's going to do. She has no job. She was in the industry, a service industry. She has no work. So it's very, very, very disheartening to hear these anecdotes, but this is what's happening with our families and our children.
Right. Well, that's some very fresh, very raw, very current data, that really speaks to what people are experiencing. And if there was a word I heard over and over in your report, it was anxiety. I think that we will have to look at this as an age of anxiety for our nation and the world, because there are so many unknowns, and it's just a perpetual state of adaptation without easily being able to plan for the future. I appreciated in your report, Wendy, how you gave data from so many different specific groups of people, and it really anticipates my next question that I think Sari will probably address, and that is, as we've been discussing the way that COVID has impacted women and women of color specifically, as well as all the different groups you mentioned, Wendy, we've been drawing on data to answer these questions. So let's talk a little bit about the importance of collecting and publishing disaggregated data that's separated by gender as well as race, ethnicity, and other factors. How can we have access to this data to help advance gender equality? I know that's been a long feminist issue, is making sure data reflects who people really are. What do you have to say to that, Sari?
So I think right as the pandemic started, a lot of decision makers, a lot of researchers noticed that we don't have a great way of collecting data from communities on a sort of day-to-day immediate basis. A lot of our data sources are collected slowly, and they're lagging, and they come, they go through a lot of validation process, which is good. But if you need to make these quick decisions and kind of measure the pulse of what's going on, then that's much too slow for something like the current moment. And so it made it clear that we do need this real-time data so we can access the impacts across different communities. And it's important for many reasons, but primarily I'm thinking about assistance and targeted measures that could be generated much more cost effectively and efficiently if we knew where the need is. It's much better and frankly also a lot more economical to target need assistance based on need rather than do this broad-based writing a lot of checks for everyone rather than focusing on those who are most in need. So Census Bureau in the spring actually did something that I was impressed by. They launched a household survey called the Household Pulse Survey that is trying to measure the household experiences during the pandemic. And it is near real time. It is disaggregated. You can get the results disaggregated by age, gender, ethnicity, race, education, marital status, and so on. It is not just the economic outcomes of the pandemic. It's really trying to get to issues such as food security, stress that people are experiencing, mental health, as well as the work-related questions that are important, income sources and those types of things. And I'm a data person, so I feel that the more that we can have these types of detailed data, and the more we can have it for large enough numbers of individuals in all diverse communities, then we will become a lot better at mitigating the negative effects of that are particularly happening for specific groups of individuals and families. It's only getting us half the way there because we do need decision makers and policy makers who can be rather nimble and willing and able to work in this targeted kind of fashion and using those data and accepting what the data is saying. It's particularly important for women and families of color. I'm not going to, Karen already gave us a very detailed picture of what families and women of color are facing. But it is true, they're more likely to be essential workers. They won't be able to work safely from home. Being exposed to health risks means that they're also exposed to economic risks should someone in the household become sick, even if they're not getting sick themselves. Just having to isolate for 2 weeks if they were exposed to someone who was sick is a massive economic risk that needs to be somehow mitigated. Many of the families also are immigrants. They might be even undocumented immigrants. And even if they have been employed and paying taxes and doing all of the duties they're supposed to be doing, they won't be eligible for relief measures, unemployment benefits, and so on. And again, that puts the households at massive economic risks, including homelessness and everything that follows from there. So having those kinds of data that can help us in real time would be very important.
Mm-hmm. Yeah, I appreciate your speaking to that. I don't know if members of our audience know that you regularly work with census data and with, the highest levels of government data that not everyone has access to do your research, which involves large swaths of the population broken down in any number of ways. And, one of the questions that I've always thought about is how we decide what questions to ask and what people to study. This is one of the things that really was brought to my attention on one of my trips to the United Nations Commission on the Status of Women meetings, where I heard country after country report on their gender data in such different ways. The same things aren't measured everywhere. Different countries and cultures have different things that they're focusing on, yet we need to learn from each other, because there are often questions that we aren't asking in our own cultures and countries because we're not thinking along those same lines. We have a certain way of expecting to do it that could always be informed by other approaches. And I feel like in these times it's absolutely essential to be learning as we go and figuring out what kinds of new surveys, like the one you mentioned, Sari, do we need to be setting up. And another thing that I've been thinking a lot about is the degree to which we need to not just study individuals and have individuals as the units of analysis, but we also need to study communities and various kinds of collectives as a unit of analysis. Because what we find is that when people are going through all of these challenges, many times they're innovating under the radar in terms of new ways to do things. And because of the kinds of things we focus on, whether it's in the news or in research, we may miss some of what's going on if we don't maybe pull from our personal lives or keep our ear to the rail of different communities. I think community-based research is more important now than ever. I'm wondering, Wendy or Karen, do either of you have anything to say to this issue of the disaggregation of data and how to be creative in this moment to really study what we need to be studying in these unprecedented times?
Well, I know it takes time and energy when you're doing a survey or trying to collect data that, for example, my focus groups that I just did this summer, it was easier to get families that were dual earner couples working from home. Mm-hmm. But we wanted to get a full picture of what families were doing. So we spent the time and energy to find the essential workers, to find the furloughed workers or the unemployed workers, to get a true picture of what families were doing and what they're dealing with. Because work from home families very often could, even though they were stressed and exhausted and burnt out, which are all horrible things to have from home, they didn't have to go back to the workforce without PPE and having no one care for their child while they were at work. It was a different feeling, different circumstances, a different lifestyle. And it was important to hear the voices of all those parents. So I think it takes time, it takes energy, but it's so important.
Yeah, that's a great point. And it really begs the question of what kind of systems level interventions and innovations do we need to solve these social problems so that it's not just individuals having to tough it out all the time. I mean, to me, this feels like a wake-up call, and the question is who's going to answer it. Karen, do you have any thoughts about what we need to do differently with data or people we need to research or questions we're not asking, this whole issue of disaggregation?
Sure. And so I think just Wendy's point about just it takes time and effort is really critical. And for me, as speaking as a qualitative ethnographer, it is time. Doing this process studies as well as just impact and community-driven work, I think, is critical at this moment. I think we need to expand and deepen our data collection methods and frameworks for sure. I think taking a public health approach that we're looking at both prevention and promotion is going to be especially important at this given time. What are we trying to prevent? How are we trying to promote? Making sure that we're using methodologies like community-based participatory research models or community-driven models where we're both surfacing the questions that need to be asked as well as the methodology to capture the data as well as the analysis and the report that critically aligns and partners with, if not is led by, communities that are most directly affected. I think it's really important to pay attention to pattern and trend data. As a member of the Massachusetts Mental Health Task Force for Children, this is an American Academy of Pediatrics, the Massachusetts division, Just recently, they in a meeting reported just kind of the impact that they're seeing in terms of the number of calls during the telehealth. It was really interesting to note that, again, parental stress was really highly reported, but the children below a certain age, 15 and younger, they didn't necessarily see any particular occurrence or parents calling in. But with DESI's reports about the next new school closing, or you can't go back to school, or you have to stay home, that's when they saw the uptick. So again, I think cross-sector, we're looking at different fields and how are we thinking a little bit more innovatively about looking at how are these things connected, as we know they all are. Issues of food insecurity, all of this, I think we need to start paying attention to sustainability, climate, all of these I think are going to be very important. So.
All right, so I think we're probably heading towards our last couple of questions. So I want to encourage the audience just to start putting any questions you may have into the question and answer box. But with our panelists, I'm also going to freestyle for a couple minutes and throw in a couple of questions that you weren't expecting. One question that I'd like to ask is, what have you learned from your own personal experiences in this pandemic period that has informed the work that you do? Because as we know, as feminists, the personal is political, and we're not abstractly not involved in this, COVID pandemic. So what have you learned from your personal life that's helping you think more deeply and clearly in your research universe? And everybody has to scratch their head for a minute.
I think one thing I've learned is that however you want to define it, your own community is going to make a difference, whether that community is based upon your family, maybe your in-laws or aunts or uncles, or people that live next door to you or across the street. I think for myself and for others, I think community has become very important during this time period, to just even have someone to talk to, someone to vent to. If your children are driving you crazy, you can't say to your children, I hate you, but you can tell your neighbor, my God, my kids are driving me absolutely out of my mind. That type of thing, I think, is so important. And I think it's what has helped me through the pandemic, is just having others I can go to, I can rely on, and that I don't have to be alone.
And that's an interesting observation, because in this sort of busy world, sometimes we've pushed our communities to the side, and now we're realizing, hey, really important. Yeah, so it gives us an opportunity in some respects to pull our communities back together, even if that has to be mediated by technology. What about you, Karen or Sari? What's your purpose of telling you?
Sure, I think the insertion of joy, creativity, and community have been critical as not just coping mechanisms, but certainly sustaining and building something new. I think innovations come up a couple of times here in this conversation. And for me, the seeds of that have been really reminding what makes you joyful, making sure that you're building in time to create in a time which can feel incredibly dismal. We're feeling restricted and hemmed in, that we still have the power within ourselves and our hands to create something new. And it can be anything from something literally a handiwork or artwork to a poem, but really tapping into that and the sustainability that it provides you to kind of make it through. And connection, absolutely, to community. And these are all things that are reminiscent of, again, anchoring truths in my culture, and it certainly informs the work that I'm doing with respect to particular Black indigeneity and our ancestral healing and traditional healing modalities. It's all coming to bear and coming together.
Yeah, I love how you pulled us back to joy. I've heard a few other people say the same thing. It's so easy to forget about joy in these times. But, I've always believed that inspiration is the fuel of life, and we have to all know where we can go to for inspiration when we most need it, because otherwise we'll just be flagging from all these stresses. Sari, what about you?
I think I gained a very full appreciation of what a patchwork our childcare system is and how fragile that patchwork is. And if anything goes wrong, even if you are a person who has some means to try to provide various forms of childcare, it can be a challenge. So my feeling is I want to go deeper into that and try to understand the various ways in which people from different economic backgrounds are trying to patch things together. I also feel like that frankly matters. If we have something like a pandemic going, we can have well-meaning policies and saying we're going to close schools. But if we don't have anything to help the families with. And the families are going to use their own networks and connections and communities, and some it'll play back into how the pandemic is going to unfold in different communities. So that interconnection of all this is fascinating.
That's an interesting observation, just about, in a way, how our system isn't as systematic or as well functioning as we sort of imagined before all this happened. You know, and that's part of why I'm really hoping that we're going to innovate out of this, and that we're going to really elevate, you know, particularly those things that we care about at the Wellesley Centers for Women, such as gender equality, social justice, and human well-being. All right, so I'm going to ask you one last freestyle question before I ask you for your closing statements. And that question is, if you could design one study or get one research question answered that has come out of these times, and your, you know, high level expertise thoughts about it, what would it be? And I'm going to ask, let's see, ding, 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 ding. Who am I going to ask first? Wendy, I'm guessing you have an answer because you're always in it.
Well, I really want to do another study on childcare, looking at before and after. And I also want to study the children and the teachers and the educators and the families. I want the entire ecosystem of childcare. That's what I want to study.
Yeah.
See what's going on. How are they handling it?
Yeah, I love that. That would be a great study. And I think a lot of people would be interested in what you would find. All right. So what about you, Sari? What would you do? What would be your...
I think I want to do a time use survey. I just want to really go into these households, because we often felt, even before the pandemic, it was a 24/7 kind of situation where we're just managing and using every moment, but somehow like there was more squeezed out of nothing. And so I want to understand what happened.
That's true. Time use studies are always very illuminating. I mean, I think about some of the early feminist research. That's how we discovered the 7 shift. It was time use research, you know, and what would we find out now? A whole nother set of things. So hoping to get to do it. What about you, Karen?
I think I'm really interested in multi-generational study. Certainly this is a time that is tied together. As we're saying, we're living in these kind of households now, and we know at the early stages of this, elders were most hit and continue to be older Americans, and particularly older minority Americans or minority Americans of color. And that's an area that I think needs to be tapped into, better understood. But what were some of the multi or dual generational types of strategies that were happening, or as you mentioned, Layli, kind of underneath or within community innovations that were happening to care for and take care of one another? So I think built in there is a resiliency question. I'm really curious about what specific strategies were used across generation for and amongst one another. That would be very interesting to me. And I think with findings that would be useful for the broad collective.
Yeah, and it would also be interesting what kind of intergenerational conversations your findings could generate in the wider population, you know, because every generation is experiencing the situation differently. Certainly it's upended things for everyone, but generationally there do seem to be some differences in terms of how people are experiencing it. All right, so one last question that I hope will evoke your concluding thoughts. Focusing on your expertise area, what are the critical policies and practices that leaders should put in place to ensure that interventions are responsive to the diverse yet deeply gendered challenges facing women during the COVID-19 pandemic? This is your chance to speak to policymakers and other people who are out there who are doing these interventions, and inject them with your wisdom. All right, Wendy, why don't you go first again?
Okay. So I'm going to go back to childcare. Childcare is essential for working parents as well as the country's economy, and hence federal investment in the infrastructure of childcare is needed. With such an investment, there could be an expansion of affordable childcare for all, and the quality of that childcare to be the highest it can be. And it is imperative to boost the wages of the profession to at least a living wage. It is essential and integral to our economy, and one can't separate childcare when speaking of an economic recovery. Childcare is not a women's issue, but should be thought of as a public good. Just as we support public schools, the same needs to be done when it comes to childcare. The airline industry received a $58 billion bailout. The same needs to be done for childcare. Childcare is the foundation of all learning, and the industry needs to help now. As Kathleen McCartney and Deborah Vandell recently said in Newsweek, Early care and education supports children, families, and the economy. So,
Great. Thank you. All right. Erin, what do you think?
Work-family policies need to be expanded to take into account the increasing caregiving roles and duties. Sick time, personal time leave, that needs to be actually bolstered and supported. Support and benefits for employees, especially for essential workers, needs to involve innovative structural shifts, partnerships with community and organizations, job share, mutual and relational strategies that need to be implemented into policies that haven't, I think, heretofore been done in ways that will have real impact for the sustainability of essential workers in particular. The wage gap issue needs to be addressed, particularly in regards to women of color, as we know that there's a disparity even within women's wages. Anti-discrimination policies, I think in general and in specific, the ways that it impacts issues of race and gender at the workplace, to protect employees, particularly at this time when they find themselves undue and put out because of this COVID-19 crisis. And I think building lastly on what I said before about research policy, to really expand and deepen, I think, the resources to really provide for broader types of research that would be innovative and thoughtful, that really involves qualitative ethnographic research, that understands the implications of public health models and making sure that those are being well funded and supported.
Given that care work of all kinds, both formally and informally, is often central in the lives of women and women of color in particular, for a myriad of different reasons, from corporate executives to frontline essential workers, it is important that education, health, and economic policies reflect this, specifically thinking about social emotional learning and education policy, that it is explored and expanded both in and out of the classroom, that we focus on adults as well as youth in our policies, that we center family and community voices and knowledge, especially in Black and Indigenous people of color communities, where often those voices, practices, cultural traditions are not included in both curriculum development process and delivery. It is important to prioritize and supply under-resourced communities with practical supports, as well as mental and behavioral health services across a range of modalities. So education and health policies that expand across a different number of different modalities that meet the needs of a more diverse communities. Focus energy and resources to elevate the attention around Native and Indigenous women's health issues, particularly in the ways that that co-aligns with the chronic issue of violence against Native women, the ongoing issue of the murdered and missing Native women, and how this has been exacerbated during the COVID-19 crisis is really going to be critical. So thinking about public health research policy and how that actually connects to our justice policies as well. And lastly, really thinking about Black maternal health policies and ones that include expanded insurance coverages, particularly during the postpartum period. As we know, this is a heightened time of susceptibility for Black women in particular. Also having insurance coverages for doula services and other culturally embedded allied supports for pregnant and parenting Black women in particular. And ultimately making sure that our health policies and our education policies listen and believe women, listen and believe women of color. Lastly, just some closing thoughts on the levers of change that we know must include awareness and action at many levels. Systems level, making sure or understanding that structural interrogation and analysis of health, economic, and justice systems are pivotal in leading to change. Organizationally, protocols for hiring, advancement, and retention must be improved, particularly for women of color. Entrepreneurial catalysts and programs will be needed. Philanthropic resources redistributed and led by people of color. On the interpersonal level, relational emphasis for change, understanding that our spheres of influence and power can be used to redirect and correct imbalances, and this is true at both home and at work. And lastly, personally, an expanded self and social awareness is being the cornerstone of any change, prioritizing self-care and knowing that it is linked to social action and justice all the way around.
I'm sorry, why don't you go ahead with your closing words and we'll let
Yes, so what I have many thoughts in my head. I think the main thing is trying to open the economy, trying to get things up and rolling so that we can have jobs for women. So it would be that reopening of small businesses, and especially providing them help so that small things don't stop them from reopening. Things like there may have been some delinquent payments, or they may be outstanding loans and other things that are not large in the grand scheme of things, but may make it very hard for businesses to come back. So that should be a priority. Same way, I think households may have been put into impossible situations where they may have not been able to pay their credit card bills, or they may have been they have lapsed rent payments. These kinds of things will leave a very difficult long-run situation where credit scores are impacted, and if you once have been evicted, it is very, very hard to be able to find another rental apartment. It's not important only for households that these types of things don't leave a long mark in their record, but also landlords and anyone who like provides housing and services for these households. I think we need to be very thoughtful that those types of issues can be systematically addressed as they affect low-income families more, and families of color. And on the school side, I think in order for us to be able to get women back to work, then we do need to get childcare and schools also first open, and then make sure that they can stay open, so that students who have been doing remote learning, especially the students who live in households with essential workers who may not be able to stay home and supervise the child, are not falling behind, which would lead to, again, bigger intergenerational issues that will take a very long time to resolve if we don't address them.
Yeah, truly, we're looking at a long-term situation. All right, I'm going to transition now to audience questions. We've gotten several in the last little while, and I'm going to start sharing them. Some of them are probably directed to specific individuals. Others are more general. I think this one may be directed to you, Sari, at first. It says, in your view, what can companies do with perks and benefits to help the inequality of work at home? Is this something that we think companies will look to help?
So, I mean, first of all, I think it's if companies are able to let people work from home, that is excellent. And then, as we have noticed, not everyone has equal capabilities to work from home in terms of your home office, Wi-Fi access, all these. There's many things, your kind of computer systems and so forth. Maybe the companies can, and that would be something that they should be somewhat more easily able to do, provide equipment, provide better home office support, provide Wi-Fi, whatever it is that can be, that people can be productive from home.
Yeah, those are great suggestions. Karen or Wendy, do either of you have suggestions about perks that companies could offer to make work better under this situation?
I think understanding that even though work from home may be beneficial for many, it's not beneficial for all. And that even though they expect work, they need to change their demands of their employees. You cannot expect that the same level of work can be done as before. Even though you want your employees to work 40 hours a week, we know that they're working very early in the morning or very late at night, and they're at their rope's end. And I think that their expectations need to be less. If you want to be flexible, also be flexible. For example, I know one company in Boston has an emergency situation going, emergency placement. What they do is they pay their employees for full-time work, but only expect to be part-time work. And we need to ask expectations for like that.
Yeah, that's an interesting analysis. Anything to add, Karen, or should I go on?
Sure. No, I think the flexibility is really important. I do also think the protocols or the standards by which they're measuring kind of the quality work is going to be really important, understanding the demands that we're under. So along with the practical equipment, technical supports, flexibility and schedule, I think the measurement in terms of actually what it is that you're producing, I think there needs to be some shifts on the part of the corporations and businesses themselves in terms of output.
Yeah, good point. All right, so the next question says, I think Wendy, this may be more directed towards you. Any thoughts from the panel on what women and men can do to be proactive, especially in the work and childcare fronts, and what can we do to support each other?
To answer, I would say write letters to your editor. Talk to and call your city officials, your state and federal. Talk to people. Let people know what's going on in your life, what's happening in your life, what problems you're facing because you don't have childcare or school, and just have your voice be heard. Don't just tell, don't keep it to yourself. Get it out there so people know. The more people that talk to people, for example, if you call your congressperson, they want to hear from the constituents. If they don't hear from you, they think everything is fine and dandy. The childcare, increasing money for childcare has been in Congress since March. We still have no money, and we may not have money. It's something that needs to be done, and no one, they don't hear from anybody, so they won't do anything about it.
Yeah, that's very interesting to think about how this gives us more opportunity for kind of democratic process, but you're also very much suggesting that people directly try to stimulate institutional change through communication. I love that. All right, so I'm going to go to the next question. I'm going to reframe it slightly, but it says, from a gender equality perspective, which countries are seemingly weathering this pandemic well, or at least better than the USA? The way I'm going to reframe it is I'm just going to ask each one of you to identify countries you're paying attention to because you think they're doing something cool that we should learn from. I know we've been maybe mostly focused on the USA, but at least Sari, I know, has an international.
Yes, I think the European countries have definitely made it a bigger priority to keep daycare centers and schools open. Many of this, like Sweden, never wanted to close them in the first place. Many of the other Scandinavian countries only closed very briefly in the spring and have been back since the spring. I hope that things continue to go well there, that they can stay open. And in some of the Asian countries too, like the return to school has been a big priority. They have also, frankly, done a much better job of managing the pandemic as well. So it's easier for them to have kids to go to school when they have managed the whole pandemic better.
Mm-hmm. And of course, we've all seen the research on countries led by women and how they seem to be having quite a strong response. All right, well, let me turn to the next question that says, why isn't there activism and social outcry around these issues? Is it because during the crisis, we are continuing to assume that women are going to clean up the mess and we will deal with this later? I worry that by the time social movements catch up to the intersectional issues related to gender inequality, it will be too late. So how might you respond to this questioner?
I think the women have been out there ever since. If you just open the paper, turn on the news, you're going to find women are very active. I've been in a group that we've been meeting every single morning since March 15th or something, talking about how we're going to get childcare open. We've been working with the state, we've been working with the federal, we've been local. We're trying to figure out how to get childcare reopened and the quantity and the quality to be increased. I think if you look at social justice, we've been out in the streets. So I think but it's not just women that need to answer these questions. Everyone needs to be a part of it. If you want progress, everyone needs to be a part of it. Everyone has to want it. And I do not want these things swept under the rug.
Right, and I think you make a good point, Wendy, about how you're out there every day in these conversations and you're working with others who are raising an outcry, and maybe what you're doing isn't always labeled activism, but it's very influential in making change. And, I think it's important for us to think about how people who are different sectors of change can work together and communicate with each other. And it's also a good opportunity to invite those in the audience to think about how they can support organizations like the Wellesley Centers for Women that live to do this kind of work. We are an activist organization in the sense that we are trying to do research that helps people, that advances gender equality, that advances social justice, and advances human well-being through research, theory, and action. All right, here's another question. Is anyone looking at impacts on older women, especially how they're impacted financially and emotionally by loss, death of a family member, especially a partner, the need to tap into retirement savings, loss of housing security, or other health risk factors. So what do we know about older women's experience of these issues under COVID? Wendy, I know your team has worked on care work, elder care and things of that nature. I don't know if there are any insights.
But not recently. Nancy Marshall's done a great deal of work, and she knows more than I do about this topic.
And you mentioned multi-generational care and anything.
Right, and I think that so it's certainly a burgeoning area of interest, and certainly in the work that we're doing at the Wellness Collaborative Incorporated, we've been hosting a series of small workshops that are particularly looking at issues of kind of grief and bereavement and loss of all kinds with regards to what's happening. And oftentimes this has had to deal with issues of our elders and our senior members and coping with loss across the long term. Many of them have lost several peer members and family members all at once. And we're looking at what does that impact look like with regards to those that in many ways are feeling kind of alone and isolated. So it's happening more in this active group work that we're doing now and thinking about ways that we can really build on that and find ways of building community in more intimate settings. And again, with known kind of community and connection, but there's a growing, especially in Massachusetts, and we're learning more with folks that are working with the Boston Public Health Commission and trauma-informed work with trying to reach out to our senior population who are having quite a difficult times, but again, finding ways that are really going to meet their needs. So not just kind of understanding it in terms of what's happening, but also really figuring out what are the practices that are going to make the biggest difference in their lives. So it's beginning.
To know that that's being done. Sari, we have a question directed to you. It says, do you think the pandemic will mean the end of the 9-to-5 workday as companies recognize that work can get done anytime since many parents have been working outside normal business hours? If so, would that be a positive or negative change for women?
I think I have bad news that I think the 9-to-5 workday in America was lost a long time ago, and companies think that women can and other employees will do work at any time, including weekend and vacations. I think, and unfortunately, this pandemic certainly didn't help clear that line. The boundaries between work and home and family have been very blurred, especially for professional women who do sort of answer email and work remotely, maybe during weekend and evenings. Somebody might find it a positive thing that they're not expected to sit at their desk 9 to 5 and can do their work anytime, anywhere. Others will find this very stressful, that there's no clear kind of work day end here, and then it starts again next morning. But I feel like this is it's certainly true elsewhere too, but it has been the case in the US for quite a long time.
Yeah, I think we've been having this conversation since smartphones became popular, at the very least, maybe even with the advent of email. But it kind of reaches back to that first question about what kind of policies and perks that could be helpful. And one of them might be like some time when you don't have to be available for work. All right, so this question is for you, Wendy. Dr. Robeson shared that 30 to 50% of childcare programs will close permanently as a result of the pandemic, and these programs are necessary for an economic recovery. Based on state and federal investments made in the past, do you think it is likely that policies that provide the necessary funding and support to programs so that they can reopen will be prioritized? What will the long-term impact be if the support for childcare programs is not prioritized?
Well, I haven't seen it be prioritized yet, given that we have been asking for money for months now and nothing has happened. So I don't see it happening until after the election. I see that we're going to have a real problem because there will not be enough childcare for the parents that need it, whether it be family childcare homes or center-based care or public school care, anything that they want. Nannies and babysitters are used, but much less frequently. I see that the childcare workforce is going to be decimated because people can no longer work if the majority of childcare providers are people of color. They do not make a working wage. They are on food stamps. They are on mass health. They get second jobs or third jobs because they cannot live on what they're making. And it's getting to be a point where if we don't do something soon, the entire economy is going to really be worse off than it is now. It's a really dire situation, and I don't think people quite get it.
Mm. All right, so we're on to our last question, and we've got 3 minutes left in which to answer it. So I think this anyone can take it, but we're going to do it quick. Any research taking place on ways we can engage in parenting differently in the COVID era? For example, I formed a pod in my neighborhood, working moms coming together to create a safe and productive schedule that supports their kids in their work. Our kids rotate to different homes. Any thoughts about that?
There have been new studies looking at pods and who uses them and how much they cost and where they're located. I know that there's been a lot of work trying to get pods in areas where parents can't afford to shell out money themselves, so they have philanthropic efforts helping them. And I think that's for, you know, if you have no one there to care for your school-age children and you need help, what are you going to do? If they're hybrid schooling, you've got to do something. And I think pods is what a lot of families are doing because they've got to do something.
Mm-hmm. Well, it's one of those kind of innovations that parents have made on their own, one of the kinds of things that we need to study. And we also need to study how people who are sometimes less resourced deal with the situation as well, because I've heard things about how it's easier to do that, you know, under certain circumstances than others. All right, well, I want to thank the three of you, Wendy, Karen, and Sari, for taking time to have this conversation today. I also want to thank everyone in the audience for attending our program this afternoon. As I mentioned at the beginning, a recording of this program will be posted on our website within the next week, and we'll email a link to the recording to everyone who registered for the program. We'll also post it on our website. Next week, we'll have another social change dialogue on the topic of advancing racial justice through research and action. And I hope you'll join us for that as well. Mark your calendars for Wednesday, October 21st at 1 p.m. Eastern Time. You can find the registration link for that program on our website. So until then, be well and thanks again.